Today we're diving into the often missed warning signs of heart attacks in women. Heart disease is often seen as a male-dominated health issue, but the reality is that heart disease is the #1 cause of death for both men and women worldwide. However, heart attacks present differently in women compared to men, which can lead to delays in diagnosis, treatment, and even a higher risk of death for women. Understanding the distinct aspects of heart attacks in women is crucial for promoting awareness, prevention, and proper care. And remember that a person will usually only have a few of the warning signs and not all of them. Women have gender-specific risk differences compared to men. While both men and women share common risk factors for heart disease, such as high blood pressure, high cholesterol, smoking, obesity, and physical inactivity, women have additional gender-specific risks that can increase their chances of developing heart disease or having a heart attack. These unique factors include, number 1, hormonal changes. Women experience significant hormonal fluctuations throughout their lives, particularly during menopause. What complicates things for women is that some of the symptoms associated with menopause also occur with a heart attack. The loss of estrogen, which has a protective effect on the cardiovascular system, can increase a woman's risk of heart disease post-menopause. Estrogen helps maintain the elasticity of blood vessels and regulate cholesterol levels, both of which are important for heart health. Number 2. Pregnancy-related complications. Conditions such as preeclampsia, gestational diabetes, and high blood pressure during pregnancy are risk factors for heart disease later in life. Women who have experienced these complications are at a greater risk of heart attacks and other cardiovascular issues. Number 3. Autoimmune diseases. Women are more likely than men to suffer from autoimmune conditions such as lupus and rheumatoid arthritis, which can increase the risk of heart disease. Chronic inflammation from these conditions can damage the arteries and heart, leading to a higher risk of heart attack. Number 4. Emotional and mental health factors. Depression and anxiety are more common in women than men, and these conditions can contribute to heart disease. Stress and mental health issues can lead to unhealthy behaviors like overeating, smoking, or inactivity, which in turn increase the risk of heart disease. How do symptoms of a heart attack differ in women compared to men? One especially crucial point to realize is that research suggests that women often experience symptoms for several weeks to a month before a heart attack. This is known as prodromal symptoms. A 2003 study of women who had a heart attack reports that 80% of the women had at least one symptom at least 4 weeks before their heart attack. Therefore, the women and sadly their doctors will sometimes dismiss the symptoms as something else besides a heart attack. So what are these warning signs that are often missed? One of the most significant ways heart attacks differ between men and women is in the presentation of chest symptoms. In men, the classic symptoms of a heart attack are often more straightforward and well-known. Intense chest pain, tightness, or pressure, often described as an elephant sitting on the chest. Women may experience pressure or discomfort in the chest, but it's often described as tightness, fullness, or squeezing rather than sharp pain. Another common symptom that women often experience weeks before a heart attack is unexplained severe fatigue and sleep disturbance. It's not just feeling tired, it's an intense exhaustion that makes it difficult to perform simple daily tasks, even getting out of bed. Next is shortness of breath, even when sitting still or lying down. When combined with fatigue, it can easily be overlooked as depression or anxiety. Women are more likely than men to experience heart palpitations or chest flutters. Heart palpitations are a feeling like your heart is missing heartbeats, racing, pounding, fluttering, or flip-flopping. You can feel palpitations in your chest, throat, or even in your neck. They are common with other non-heart issues like anxiety, overactive thyroid, caffeine, exercising, and dehydration. If they last more than 30 seconds, it should be checked out. And then there's indigestion or nausea, which can easily be mistaken for a simple upset stomach, unless of course you had food poisoning when your chow mein turned into to mein. Both men and women can have pain in the left arm, upper and lower back, neck, jaw, or stomach, but studies show it is slightly more common in women. Sweating without an obvious cause, such as exercise or hot weather, can also be a sign of a heart attack in women. Due to hormonal changes, this one can easily be missed. Cold sweats in particular are a warning sign that the body is in distress and may indicate a heart attack is occurring. These symptoms can be so subtle that for women they're often brushed off as mere anxiety or stress, But the truth is that these symptoms can be life-threatening if left unchecked. Also, please be aware that there are other symptoms that are not listed here. Check out our link to the American Heart Association. And don't be mistaken, men can experience the same symptoms as women. It's just that some studies show that women may experience these symptoms slightly more often than men. I want to share a story that really drives this point home. Susan, a 42-year-old woman, was experiencing persistent fatigue and shortness of breath for weeks. Her doctor initially attributed it to her busy lifestyle, but she knew something was wrong. It wasn't until she suffered a heart attack that the true extent of her condition was revealed. Luckily, Susan's story had a happy conclusion, but it highlights the importance of recognizing these warning signs and taking proper action. If Susan's doctor had taken her symptoms more seriously, her heart attack might have been prevented. The importance of awareness and education regarding heart health in women cannot be overstated. It's crucial that we break down the stereotypes and misconceptions surrounding heart attacks and empower women to take control of their health. Let's summarize the key points often missed by women. Number 1. Remember that women often experience symptoms weeks in advance of a heart attack. Number 2. Women often experience extreme fatigue with early onset of a heart attack. And number 3. Women often experience sleep disturbance before onset of a heart attack. Number 4. Chest pain in women is often described as a squeezing, pressure-type pain and not always as a sharp pain. And number 5, upper back pain. So, what do you think? Have you or someone you know experienced a heart attack? Do you know someone having these symptoms? If so, it is important to get checked out by a doctor. And don't be afraid to call 911 if you are currently experiencing these symptoms. Please share your thoughts and experiences in the comments below so we can all learn together. And don't forget to like us and subscribe to stay informed on the latest health information. So until next time, remember our motto of think well, eat well, move well, and be well. Take care.
Thanks for watching our video. And if you liked it, please hit the like button and give us a thumbs up. So until next time, be well, stay safe, and stay positive. Take care.